My name is Lavonna White, and this is for my capstone project. And my project is called Opioid Addiction. What is opioid addiction? Opioid addiction is uncontrollable use of pain medication. Opioid addiction includes any medications used to relieve pain. Anyone with opioid addiction has a difficult time quitting drugs. Understanding addiction. Addiction is a primary chronic neurobiological disease with genetic, psychosocial, and environmental factors influencing its development and manifestation. It is characterized by behaviors that includes one or more of the following: impaired control over drug use, compulsive use, continued use despite harm and craving. Some people take pain medication for the wrong reasons, like to help them feel high, to help eliminate problems, or to make them feel differently. There are different medications used for opioid abuse. Here are several forms of addictive painkillers, one of which is oxycodone, hydrocodone, codeine, morphine, and fentanyl. Opioid is a serious problem in the world. In 2015, 20.5 million people had some form of substance abuse, and this was including adults and children. Some of these people turn to professionals for assistance. There are treatment facilities in different areas. The facilities provide counseling, drug screenings, and medication for treatment. It is estimated between 26.4 million and 36 million people abuse opiates worldwide, with an estimated 2.1 million people in the United States suffering from substance use disorder related to prescription opioid pain relievers in 2012, and an estimated of 467,000 addicted to heroin. With opiate addiction being a problem, people need to get help treating opiate addiction. First, what they can do is find a treatment facility. They can seek counseling, set goals during treatment, focus on reducing their drug use, and then even taking the next step to try to quit using drugs. Some of my key findings during my research was I found that there were programs introduced in schools to help students learn what to look for with opiate addiction. Secondly, I found that opiate addictions are called different names like pure hard candy, sweet drugs, noise, joy, lemonade, and many more, which I found very strange because I know that kids will use these names. Third, my third key finding was there are different federal agencies that work to control opiate addiction. For example, in the United States, there's the Drug Enforcement Administration, the U.S. Marshals, and also the FBI. Key findings from my literature review. Opiate addictions were higher among unemployed and uninsured people. In addition, more people used opiates in small towns and larger cities. Opioid addiction treatment is offered in hospitals and is considered inpatient treatment. There are two forms of medication used to treat opiate addiction. They are methadone. Key findings from my literature review. Opiate addictions were higher among unemployed and uninsured people. In addition, more people use opiates in small towns and larger cities. Opiate addiction treatment is offered in hospitals and is considered inpatient treatment. There are two forms of medication used to treat opiate addiction. They are methadone and Suboxone. Treatment with medication is considered medication-assisted treatment. During one of my interviews, I had several interview questions. The questions were, what type of referral programs are available? Are the social workers required to follow up in hospitals? What happens when an individual refuses treatment? Do the hospital offer on-site treatment? And what areas do hospitals refer patients for treatment? Another question was to find out what are the different kinds of treatment the facility offers. Are the programs inpatient or outpatient? What are the costs associated with the program? What approach do your facility use? And do the company accept any insurance of any kind? I also explored the kinds of problems opiate addiction is causing. Opiate addiction is affecting a lot of the population. Opiate addiction is affecting the way people work. It's also affecting families. It's causing death. It's causing health problems. And opiate addiction is causing the country to spend billions of dollars on treatment programs. When some people overdose on medication, they actually have to go to the hospital. So what I wanted to find out is what kind of programs or treatment the hospital offers. And I found that the hospital offers inpatient mental health services, psychiatrist treatment, mental health evaluations, group therapy, individual therapy, and outpatient treatments. The Salvation Army is a place that offers different services to individuals. The Salvation Army is known in different areas. The Salvation Army has different programs for people with addictions. Their programs help fight addiction by using spiritual direction, individual and group counseling sections, and holistic work therapy. The program helps people throughout the year become self-sufficient. So I also explored the different programs the Salvation Army offers. They offer build work programs. This program helps people learn skills so that they can find jobs. Social skill program help individuals learn how to communicate with others so that they can seek and maintain employment. The Salvation Army also restores families. The Salvation Army provides individuals with tools that needs to restore relationships with their family. They offer spiritual help for individuals to gain stability. I also explored a drug called fentanyl. It is what I believe to be one of the most dangerous drugs. This drug is dangerous to the touch. As with any drugs, there are side effects like shallow breathing, pinpoint pupils, nausea or vomiting, dizziness, loss of consciousness, and heart failure. With this form of drugs, only a small amount is needed for a person to overdose or die. I believe that these drugs and any other addictive drugs should be avoided. How can we solve opioid addiction? Professionals can reduce the amount of painkillers prescribed. Professionals can give alternative medication for pain relief. Professionals should monitor clients using addictive medications. There should also be individuals monitoring the amount of medication a professional prescribes. Professionals should always have resources and treatments available for clients in need. We're talking about solving the problem for opiate addiction. We can also solve opiate addiction problems by making patients aware of the signs of addiction and drug abuse. Professionals can make sure they are not providing painkillers for a long period of time. Trying to reduce the milligrams of medication prescribed. We should be able to look for signs of medication abuse, such as someone lying to get medication or going to different professionals for pain issues. We can provide treatment and counseling for those requiring help. Any professional found prescribing or overprescribing medication should receive fines. And we can also solve this problem by reporting the misuse of any medication.